Congress returns from its July 4th recess today, and repealing and replacing Obamacare is the top of the agenda. But young farmers have concerns about the current bill. Sarah Mock in Washington has more.
America's rural communities are aging, and for young people who hope to return to their hometowns, healthcare is a primary concern.
Talk about is especially if you're a young person, if you're fortunate enough to be able to find a job in rural America, are you going to raise your family in a town where you've got to drive 2 hours to a hospital? I mean, are you comfortable with that? A lot of the viability of rural communities is based on its access to health care.
The Congressional Budget Office estimates that coverage under the new bill will be more expensive for the average young farmer than options under the ACA. But advocates, including the president, point to the lack of options on state exchanges as evidence that the program has failed and must be replaced.
Because the stakes are incredibly high for young farmers, many of whom started their businesses after the Affordable Care Act was the law of the land. And so they rely on a lot of the subsidies on the independent market because they are small business owners. A great many of them have been covered under the Medicaid expansion and are very concerned with what they're seeing proposed in Congress to roll those back.
As members of one of the nation's most dangerous occupations, farmers often say that lack of access to coverage and healthcare facilities can be a deal breaker.
We ask young farmers that have left farming why they left. Again, the challenges that they cite are the same as we hear from aspiring and current farmers. It's the land was too expensive within the context of them trying to start a business. They either lost health care or had to get a job off the farm in order to pay for health care. Anytime you hear a story like that, it's harrowing.
Young farmers and rural citizens may be doubly impacted by healthcare changes. As premiums rise, many are expected to go without coverage and care, threatening the viability of rural hospitals.
When they're not required to have health insurance, they opt out. And then when something happens, that risk is borne by the entire community. So in a lot of cases, that cost, those extreme costs that aren't covered by insurance, it raises the risk profile for the entire community. And then the question about rural access, right? Hospitals are closing.
Critics suggest that over time, this healthcare bill could actually exacerbate the aging farmer problem by making rural communities less desirable places to live, and by making it even more costly to support families, especially young families, on the farm. In Washington, Sarah Mock, RFD-TV News.
As many as 9 Republican senators have expressed concern over the current bill, and many of them are from rural states. Now, if they fail to pass the bill, some Republicans want to repeal Obamacare and worry about replacement later on, while others, including Majority Leader Mitch McConnell, prefer a legislative solution to shore up health insurance marketplaces. Stay with us. Meteorologist Tim Ross has your first look at the forecast for a brand new week right after this.